that young women who use hormonal contraceptives have 3 times the risk of suicide compared to those who have never used this type of birth control. This is the information I wish I had before I started the pill, or during the decade I spent on it. Today we're going to be talking about the issues of using birth control for pregnancy prevention, hormone symptom management, and the major side effects that come along with using hormonal birth control. We'll also cover post-birth control syndrome, a condition that arises after women discontinue birth control. I'm the first physician to develop protocols to help women stay safe on birth control, transition off when they're ready, and avoid post-birth control syndrome, which is why I wrote about it in my book, Beyond the Pill. I'm incredibly passionate about helping women understand their hormones and address them naturally, without feeling dependent on hormonal birth control, which is why you'll find protocols to eliminate common hormone concerns within my book. I believe that prescribing birth control to treat symptoms of hormone imbalance without any question of the root cause is a disservice to all women. Does that make me anti-birth control? No. In fact, I consider myself pro-informed consent, which means giving you all the information you need to make the best decision for your body. And today, I'm going to be giving you just that. This is the information I wish I had before I started the pill, or during the decade I spent on it. And as a first-generation college student, I'm super grateful that I had this tool available to enable me to achieve my goals and have the freedom to have a baby when I was ready. I think we can all agree that the invention of the pill was totally revolutionary, and it resulted in sweeping social and economic improvements that gave women the freedom to choose whether or not to have children and work outside the home. It quite literally changed women's lives. In fact, one study found that the pill was partly responsible for an estimated 30% increase in women's wages by the 1990s. Access to the pill also contributed to higher college enrollment and completion rates among women in the 1960s and 70s. There's no denying the facts. Hormonal birth control was a total game changer for us gals. But there's more to the birth control story that many of us haven't been told. And as we dive into birth control, I want you to know we're talking about the pill, the patch, the ring, the shot, the implant, and the hormonal IUD. One of the most common side effects that women complain of on the pill is changes in mood. A study in the Journal of the American Medical Association of over 1 million women showed that women who began the pill were 23% more likely to be prescribed an antidepressant, which means it contributes to a bit more than moodiness. Researchers went on to discover that women who used the progestin-only or mini pill were 34% more likely to be prescribed an antidepressant. Another recent study has discovered that young women who use hormonal contraceptives have 3 times the risk of suicide compared to those who have never used this type of birth control. The study found that the threat of suicide was highest during the first 2 months after beginning the pill, the ring, the hormonal IUD, or the patch. While the risk did plateau after a year, it still remained higher compared to that of women who never used hormonal contraceptives. The patch had the highest danger of suicide attempts, with the other hormonal contraceptives following closely behind. Oral birth control is associated with an increased risk of stroke, heart attack, insulin resistance, high blood pressure, elevated cholesterol, and the development of autoimmunity. Birth control can be a great tool to prevent pregnancy, but it seems that every gal who comes into my practice is on the pill for a different reason. They've had acne as a teenager, painful periods, or they were diagnosed with endometriosis or PCOS. Same end results for all of these different issues: birth control. In fact, 60% of women are actually using birth control for primarily symptom management, not necessarily to prevent pregnancy. But as you've learned in this course, there are so many ways to work with your body to balance your hormones naturally. The primary way that birth control pills prevent pregnancy is to shut down brain-ovarian communication. Hormonal birth control is designed to stop ovulation by suppressing the production of two brain hormones, follicle-stimulating hormone and luteinizing hormone. FSH and LH, as they're referred to, work together to mature an egg and trigger ovulation. Now, there are two types of pills. There's the combination pill and the progestin only. The combination pill is most commonly used and contains synthetic estrogen and progestin. It's more effective and has less breakthrough bleeding. This combo pill suppresses ovulation, thickens cervical mucus to block sperm, changes tubal motility, and thins the uterine lining. The progestin-only pill, aka the mini pill, is typically used by women who have had adverse reactions to synthetic estrogen or are currently breastfeeding. It only stops ovulation, though, in about 60% of women. In progestin-only contraceptives, like the mini pill or the IUD, not all women stop ovulating. Progestin works by thinning the lining of your uterus, the endometrium, so that if an egg does become fertilized, it's unable to implant in that uterine lining. This is one way in which women have lighter or absent periods while using a hormonal IUD. It also thickens cervical secretions, making it difficult for sperm to make it to the egg in the event that ovulation does occur. Now, what about that placebo week while you're taking the pill? That's just like a normal period, right? Nope, not even close. When you take that placebo week of pills, you're not actually getting a period because you never ovulated. This isn't a menstrual cycle. Instead, this is what's referred to as a withdrawal bleed. So when your doctor tells you that your period is fixed by using hormonal birth control, you can understand that it never did actually impact your menstrual cycle in a positive way. It only induced a medication withdrawal bleed. Side effects and issues associated with the use of birth control include digestive problems like leaky gut, gut dysbiosis, and inflammatory bowel disease. In fact, one study that came out of Harvard showed us that if you have a family history of inflammatory bowel disease, specifically Crohn's disease, after 5 years on the pill, you're over 300% more likely to develop that condition yourself. Now, we also see issues with energy reduction while women are on birth control. This can result in fatigue and adrenal and thyroid dysfunction. Skin issues are no stranger to women using birth control. It can range from hair loss to dry skin, new onset acne, and you can see unfavorable changes in your nails as well. We've already discussed mood disruption, and yes, depression can be an issue, but you can also see anxiety, panic attacks, and mood swings develop with the use of birth control. Now, you may already know this, but lady part disturbance is something that comes along with the pill use and other forms of hormonal birth control as well. Low libido, vaginal dryness, chronic infections like yeast infections, having painless sex, and even painful orgasms are all on the table while using hormonal birth control. The pill in particular is a huge drug mugger. That means it depletes nutrients like crazy. Vitamins, minerals, and antioxidants such as folate, B12, magnesium, selenium, zinc, CoQ10, vitamin C, vitamin E, and so many more are impacted while you're on birth control. It also sabotages your body's ability to use thyroid and insulin at the cellular level, and increases the risk of blood clots, which is what leads to strokes. A study done in 2005 from the Journal of Thrombosis and Hemostasis found that women with a gene mutation, MTHFR, which is an enzyme that helps you utilize folate, had more than a 5-fold increased risk of stroke while using the pill. We also know that birth control is associated with an increased risk of breast, cervical, and liver cancers, and, as I've mentioned, can raise your risk of diabetes. In fact, one study found that using birth control for 6 months or more in your lifetime puts you at over 30% increased risk of developing diabetes when you enter menopause. So with all of that, you might decide that birth control isn't for you anymore. You just stop taking it and everything goes back to normal, right? Unfortunately, this isn't what myself and many physicians have found clinically, and certainly not what women report. In my clinical experience, the majority, if not all of women struggle in some way to break up with birth control. It's what's called post-birth control syndrome. And it's a term that refers to the collection of signs and symptoms that arise when you stop using birth control. These can be symptoms you were suppressing with birth control, or they can be added side effects that birth control created in your body and it's just now waking up to. And for some women, they develop completely new symptoms that they've never had before. Remember that birth control shuts down communication between your brain and your ovaries so that you don't ovulate for as long as you're taking it, which means when you decide to come off, there can be some issues in reestablishing that communication. Other symptoms of post-birth control syndrome include amenorrhea, or a lack of a period. And that's typical up to 3 months after stopping birth control, but anything outside of that is considered abnormal and warrants testing. Women can also experience period problems like heavy, painful periods. Hypothyroidism can be triggered from starting and stopping birth control. Having new onset of terrible acne that won't just go away and isn't isolated to the face isn't uncommon to see. In fact, it seems that acne in post-birth control syndrome can show up pretty much anywhere. Women complain of back knee, neck knee, chest knee, and even butt knee. Now, new onset of neurological symptoms are also something women report. Brain fog, depression, and new onset of migraines. Women can start losing their hair when they come off of birth control, noticing that they have high blood sugar or they can't seem to maintain their blood sugar and they're feeling hangry all the time. Feeling anxious, nervous, having racing thoughts or worrying when you're trying to go to sleep isn't uncommon with stopping birth control. And you may even feel gassy or bloated and have changes in your bowel movements. We also see that inflammation and immune system imbalance can be triggered with stopping hormonal birth control. Now, if you're feeling this is something you're struggling with, you'll want to consider the same hormone testing we've talked about in this course. And you'll want to give yourself at least 3 months off of birth control to get the most accurate lab results. To address post-birth control syndrome, I've developed the Brighten Protocol, which includes 5 fundamental steps every woman should take if she's ever used hormonal birth control. Number 1 is you have to replenish your nutrient stores. I hate to break it to you, but you can't just out-diet the nutrient depletions of birth control. Now, diet is always foundation, but you're going to need to consider using a multivitamin or prenatal to really boost those nutrient stores. And if you're on birth control right now, you should definitely consider supplementation. Number 2 is you have to identify your hormone imbalance. What drove you to get on birth control in the first place? And what's driving these symptoms now? The hormone quiz we provided you in this course will help you do just that. We also have to heal your gut. You see, while you're on hormonal birth control, it induces intestinal hyperpermeability or leaky gut. And researchers have compared the effects of hormonal birth control on your microbiome, that is the good gut bugs, to that of antibiotics. Now, I don't know about you, but I don't know a lot of people who have spent decades on antibiotics. So this impact on your gut is no joke. We have to bring in probiotic-rich foods like sauerkraut and kimchi. We need to be making sure we're eating plenty of fiber so that we're not only repopulating the gut with probiotics, but we are tending to them and tending to the terrain. We also want to consider supplements like zinc carnosine and slippery elm to really help repair the intestinal lining. Following birth control, I recommend that every woman tends to her detox system. Tomorrow, we're going to be talking a whole lot more about detox and how to love up your liver, but I want you to understand your liver takes one for the team for as long as you're on birth control. We've already talked about the genetic alterations that can happen, but there's also structural alterations in which we're at a higher rate of developing liver tumors while on birth control. Now, these are benign liver tumors, but it's still an issue when you have structural changes to your liver. It means these tissues can't operate and function the way they're meant to. And with all those nutrient depletions, you can't run your detox pathways efficiently. More on that tomorrow. Now, the last thing we need to focus on is metabolic repair. Hormonal birth control is inflammatory. In fact, they've measured women's blood, and specifically C-reactive protein, or CRP, and found that once women start birth control, some have 3 times the rate of inflammation compared to women not on birth control. In addition, it alters cholesterol metabolism, leading to high cholesterol and insulin resistance. It's what I call in my book, metabolic mayhem. And as you've learned in this course, that is foundational to having optimal hormones. Now, here are some other tips on healing from post-birth control syndrome. We want to restore specific nutrients to get those hormones in check quick. B6 is one that is so crucial for our hormonal health and our cardiovascular system. B6 helps you make progesterone, which can be low following discontinuation of any form of hormonal birth control. Up to 100 milligrams per day may be the most beneficial dose for treating PMS and mood-related symptoms. You can also find B6 in wild salmon, potatoes, and turkey. Magnesium is a mineral we have talked a lot about in this course, so you already know how important it is. Magnesium is also one of the many nutrients that birth control depletes. It's important for insulin production and can create a sense of calm in our nervous system, which is a big help when we are balancing our hormones. You want to aim for at least 150 milligrams daily, and doses of 300 to 600 milligrams may be best for you. Zinc is another crucial mineral for women with post-birth control syndrome. Although it's found in pumpkin seeds, red meat, chicken, oysters, clams, and lots of other shellfish, it can be hard for your body to replenish its stores in the short term. Aim for 15 to 30 milligrams of zinc per day, depending on how much you're also getting through food sources. It's important to note we always need to have zinc and copper in balance together. For those super painful headaches, B2 or riboflavin at a dose of 400 milligrams a day helps many people reduce the number of migraines they have. Riboflavin is more of a preventative therapy and has to be taken for at least 1 month to see any effect. 3 months is ideal as the minimum amount of time to evaluate the therapy. Good food sources of riboflavin include salmon, eggs, and almonds. Now, if you're experiencing painful periods and that has you feeling like you need to go right back on birth control, I want you to know that there's a hormone-like substance known as prostaglandins that could be driving this. When prostaglandins go high, they cause the contraction of our uterus, which is great when you're birthing a baby or you need to shed the uterine lining, but too many prostaglandins can lead to severe period cramps. But do you know what works best to put those prostaglandins in check? Increasing your omega-3 fatty acids from cold water fish or supplementing with omega-3s and bringing in that favorite mineral, magnesium. Now you might be thinking, I've decided to ditch the pill, but I still don't want a baby yet. What do you do? I encourage you to talk with your doctor about non-hormonal options like the copper IUD, barrier methods like condoms, and fertility awareness method. In fact, meeting with a fertility awareness educator can be tremendously valuable in helping you identify signs that you are fertile and get to know your body better. Let's talk about the science behind fertility awareness method and basal body temperature monitoring so that we can discuss birth control alternatives and ways to monitor your fertility. Remember, progesterone is released from the corpus luteum after ovulation and has strong effects on the brain, one of which is to increase body temperature. As a result, daily monitoring of your temperature can be used to document progesterone production, and it can help you identify when you ovulate. This technique requires the use of a special basal body temperature thermometer, which typically has units from 96 to 100 degrees Fahrenheit, so that each 1/10 of a degree is easily distinguishable. You can find these thermometers on Amazon or at a local pharmacy. For this to be accurate, you need to take your temperature roughly the same time every morning when you're in your basal state. This means before you get out of bed, use the bathroom, or have anything to eat or drink, you pop that thermometer under your tongue and take that reading. Even though there is an expected amount of variability with daily use of the thermometer, an approximate 0.5 degree Fahrenheit rise in body temperature can be detected just prior to the luteal phase, indicating that ovulation has occurred. In a normal cycle, the temperature rise begins 1 or 2 days after the LH surge and persists for at least 10 days. Therefore, temperature changes are sufficient to retrospectively identify ovulation. You can predict ovulation by the temperature changes that occur with basal body temperature. But it's also important to note how you're feeling in your body. We want to look for changes in fertile cervical mucus, which will be like the consistency of a raw egg white. And if you're feeling more in the mood, odds are ovulation is about to come. Now, these days we have really cool femtech devices available. If you're going to be using basal body temperature, you can connect it to apps in your phone. And there are even devices like Natural Cycles or Daisy, which are thermometers that will record your data and compare it to a large database of other women so that you can dial in your fertile window even quicker. A really cool thing to note is that Natural Cycles is the first femtech device approved as a contraceptive device by the FDA. Now, if you're a woman with PCOS, irregular periods, perimenopause symptoms, or you're breastfeeding because you've just given birth, you need to meet with a fertility awareness educator to make fertility awareness method work for you. You might have heard that fertility awareness method is a gambling method. In fact, there's doctors who will joke that if you're using FAM, as it's called, it's a "I'll see you when you're pregnant" method. But when you dig into the research, it's been shown to be over 99% effective with perfect use. And did you know that the typical use of the pill, that is the way that we actually take it, it's only 91% effective? So your odds of getting pregnant on birth control or with FAM are about the same. With all forms of contraceptives, we have risks. And the risk with fertility awareness method is that you could become pregnant. It is crucial for you to avoid sexual intercourse or use a barrier method during your fertile window. Now, when we see reports coming out that FAM has a high failure rate, it's often because women and their partners didn't heed the warning that they were in their fertile window and didn't take precautions to avoid sperm meeting egg. If you're super interested in this conversation about FAM, we've included an article for you in your resource section that will give you all the details you need to know about how well does it work and how to do it right. Now, we've all heard that condoms are great at protecting us from sexually transmitted infections, or STIs. But how well do they work for pregnancy prevention? When used correctly, about 2 out of 100 women will become pregnant in the first year of intercourse. That number jumps to 18 per year, though, with imperfect use. The user has a huge influence on the outcome, which is why it's important for both men and women to know how to properly use a condom. And if you pair condoms with fertility awareness method, you'll only need them for about 6 to 8 days out of the month. I often get asked about the use of spermicides. Spermicides that are placed in condoms have not shown to be more effective. In fact, the addition of spermicides shortens the half-life of the condom, meaning a higher rate of failure. In addition, there have been studies showing an increased rate of urinary tract infection, and they can disrupt your vaginal microbiome. That concludes our discussion on birth control. There's honestly so much to say about birth control and post-birth control syndrome that it could take up an entire course on its own. I literally wrote an entire book on it. But hopefully this gets you on the right path.
Hey, thanks a lot for watching. If you enjoyed this video, then I think you'll love this one too.